Hey, what's going on? I'm Dr. Leila Hariri, a family and cosmetic dentist for more than 22 years, and you're listening to Ask Dr. Leila. Anything you need to know about dentistry. We're going to talk about teeth, prevention, oral health, and tons more. So relax, listen, and smile. Welcome back, everyone, from a beautiful long Eid weekend. I hope everyone is recharged and had the most awesome time with yourselves, family, and friends. I sure did. I was able to get the two teenage boys out of their rooms and spending some quality time with me, which made my world. It was really lovely, and I'm all ready to be back at the clinic and seeing your beautiful smiles. Today we're going to be discussing receding gums, something that I can say I see pretty much in all middle-aged patients. But as I will speak about, it's not just because of age, it's because of some of the things that we do that causes our gums to recede. And always remember, genetics plays a big role as well. Receding gums are a condition in which your gums pull back from the tooth surface, exposing the root surfaces of your teeth, leading to sensitivities and possible root decay if not catched early. There are a variety of treatments available, depending on the severity of tissue loss. The earlier the diagnosis and treatment, obviously, the better the outcome. The California Dental Association estimates that 3 out of every 4 adults have some form of periodontal disease. This includes receding gums. It's a progressed form of gingivitis. Periodontal disease is a progressed form of gingivitis. It first starts off with a buildup of bacteria and plaque within the gums and the teeth. Over time, stuck-on plaque damages the gums and causes them to fall back from the teeth. In severe cases, pockets form between the teeth and gums. This creates a breeding ground for even more bacteria and plaque to form. Receding gums may be caused by a number of factors, including aggressive brushing over the long term. So it's really important that you ask your hygienist, if she or he doesn't already explain to you, on your brushing technique. And you're honest in what you use, whether you use soft, medium, hard bristles, electric versus manual. And so the technique is very important. Another factor is hardened plaque buildup tartar. As it sits there, it causes irritation, and the gums recede in order to protect themselves due to the inflammation that builds. Smoking, hormonal changes in women, family history of gum disease, diabetes, and after ortho, some orthodontic work may cause gum recession, depending on the angulation that they're bringing, the teeth in. Certain medications can cause dry mouth. This increases your risk for receding gums. I did a podcast on dry mouth. I really advise you guys to listen in on that. But just to touch on it, dry mouth means your mouth has less saliva than it should. Without adequate saliva, the tissues in your mouth can become vulnerable to bacterial infections and injuries. According to the CDA, receding gums are most common in adults 40 years of age and older. For this reason, it is often misconceived that it's a normal sign of aging. Also, more men than women develop receding gums. So the symptoms of receding gums can include bleeding after brushing or flossing, red swollen gums, inflammation, bad breath due to the amount of bacteria that's kind of sitting. It's like a bowl. And if it's just receding is one thing. When I tell people it's not only receded, but it's gouged in, it's like a bowl collecting food, that's even more of a problem. Pain at the gum line, especially sensitivity to cold. When people come in and say, Dr. Leila, I have sensitivity to cold, I can bet that it has to do with recession. Unless they just had a new filling put in. And then sensitivity to cold, that could be normal for some time. Visibly shrinking gums, exposed tooth roots, and loose teeth. Receding gums and other forms of periodontal disease are diagnosed by a dentist. A physical examination can indicate issues. A probe may also be used to measure gum pockets. A probe is a process that uses a small, painless ruler. According to the National Institute of Dental and Craniofacial Research, Normal pocket sizes range between 1 to 3 millimeters. Anything larger is a sign of gum disease. A diagnosis of receding gums may warrant a referral to a periodontist, which is the gum specialist. A periodontist can determine the best course of treatment to save gum tissues and your teeth. First, if an infection is found in the gums, antibiotics may be prescribed. I generally cover the roots with a tooth-colored filling, composite. I try to choose the same color as your tooth, and once I'm done, it needs to be superbly polished. If not, it's more of a plaque trap because any rough surfaces attract the plaque like a magnet, and where it's defeating the purpose. And really polish it in and blend it into your tooth so that when you smile, you won't even know where the filling is, but it's protecting the root. If the periodontist feels that the support of the tissue is being undermined, then that's when we discuss, rather than me filling it up with composite filling, then we discuss gum grafting, which is normally taken from the palate. So surgery is used in the worst cases of receding gums. There are generally two options, flap surgery and grafting. I'm going to go into flap surgery, which is a deep tissue cleaning used if other treatments fail. It gets rid of bacteria and tartar buildup within the gums. In order to perform this surgery, a periodontist lifts up the gums and then puts them back in place when the procedure is over. In grafting, the goal is to revive either gum tissues or the bones. During the procedure, the periodontist places either a synthetic particle or a piece of bone or tissue to help the gums grow back. It's important to note that this process cannot be successful over the long term without proper oral health care. So please book with your hygienist every 3 to 4 months if you fall into this bracket. The CDA estimates that periodontal disease such as receding gums are responsible for about 70% of adult tooth loss. When there is not enough gum tissue to hold tooth roots in place, the teeth are vulnerable to falling out. In some instances, multiple loose teeth are removed by the dentist before they fall out. Perhaps one of the best tools for preventing receding gums is to see your hygienist for regular cleanings and your dentist for checkups. Even if you don't experience any symptoms, a dentist can identify early signs of gum disease. You can also help prevent gum problems by practicing small oral health habits. While regular flossing and brushing removes bacteria, food particles, and plaque, tartar may only be removed with dental cleaning. Since tartar can contribute to gum disease and receding gums, this is why biannual cleanings, at the minimum, are so vital in preventing these types of complications. The outlook for early stages of gum disease can be good, but only if the problem is treated early. You also don't have to wait for a dentist to detect signs of receding gums. If something in your mouth doesn't look or feel right, give your dentist a call right away. You may be able to treat gingivitis before it progresses into receding gums. As a recap, receding gums can be quite painful on brushing, and for myself, I had one and it was super painful to eating honey, anything sweet, and extremely sensitive to cold. Now, if it's just the gum has gone down, that's something, but if it's gone down and you keep over brushing it, so it's a double-edged sword. You don't brush it, you'll get decay sitting in there causing root decay. Because the nerve, the root the nerve is sitting behind it. Think of it this way, if you can picture it in 3D, but it's the root. We're discussing the root of the tooth. And if you overbrush it, that's how you gouge it in and cause it to be like a bowl so that there's, very easily the food can just sit in there. So it just takes that right amount, and it's best if your dentist catches it early and fills it out with the composite filling that I spoke about. And in rare cases, not rare, but we're trying to do fewer graftings if at all possible, because the long term still is not 100%, but not much is 100%. But in rare cases, we suggest for you to do grafting. But otherwise, please make sure you see your hygienist and dentist regularly to catch these early. And as always, thank you for tuning in to Ask the Dr. Leila podcast. Any questions, inquiries, please reach out. And until next week, have a lovely week, everybody.